We have a question from Dora from Southern California, at Dora Dearest, who's asking, what's the best way to prepare fat when you're having a BBL? Well, what she's asking about is what happens to the fat between the time of removing it with liposuction and then re-injecting it into the butt, because that's how a BBL is done. By doing that liposuction, you're removing the fat from different parts of the body, and then you've got to do something to isolate the fat so that you can re-inject it into the butt and do the butt augmentation. Now, doctors will do all kinds of things. You can put it in a centrifuge and spin it around, really pack the fat in. You can allow the fluid to level off and just pour off the excess fluid, leaving only the fat behind. Some doctors will pour it through a strainer or mash it through a strainer to really separate the fluid. Some people use gauze, special kinds of gauze. It doesn't really matter what you do. You just want to be sterile and clean with your technique. You want to make sure that you are isolating healthy fat and not physically damaging it. And you want to be careful, of course, with your technique and how you put it in. I like minimal touch technique. I just let it separate, but it doesn't really matter as long as your surgeon gets good results and stays safe.